Congratulations, you are just starting your orthodontic treatment with fixed appliances. It's a big decision, and we want to help you get the absolute best result out of this whole process. So we need to give you a bit of information and give you some instructions about how best to manage this treatment. First of all, what to expect. As you get the brace on, it is completely painless. It's almost like going to the hairdresser, but instead of us messing around with your hair, we're messing around with your teeth. We're going to apply the brackets, put them in exactly the right place, and then put the wires in that are gently going to apply pressure to your teeth. A few hours after the braces have been fitted, you will probably have an experience of a little bit of pressure in the teeth. This is the little bit of discomfort that some people experience. Some people get none of this. If you do experience this, you might need a normal painkiller, but it will only be that. I know if 2 or 3 days after that, it will have all gone. We also need you to care for your teeth as carefully as possible. Regular visits to the dentist are to be encouraged. So if you have 6-month appointments with your normal dentist, please go to those appointments. We'll need to see you much more regularly than that, every about 6 to 10 weeks, depending on your stage of treatment. So please keep your appointments, and if you do have to miss one, make another one very quickly and come back and see us. For the treatment to be a success, we need you to look after your brace really well. We need you to eat the right things and avoid the really hard or chewy foods that might break a bracket. Your jaws are very strong and your braces are not quite as strong as that. So please avoid those toffees, bars, hard sweets, French bread, even a hard pizza crust could break a bracket. Chewing gum is another food which, if you took it too often, it will damage your wires. It might not break the brackets, but it's going to affect your treatment and cause it to be a longer treatment. So please avoid chewing gum. Dental health always comes first ahead of orthodontics. We need your dental health to stay really good throughout the treatment. Please avoid excessive sugar in all its forms. So yes, the typical sweets, Coke, fizzy drinks, minerals, but also things like fruit drinks, drinking yogurts, smoothies, those kind of things. They're loaded with natural sugars, and if you take them too often, they can cause all sorts of problems and weaken the enamel of your teeth. Cleaning. We need you to brush your teeth really well. We're going to focus now on how to brush your teeth properly, where you really need to focus on not just the teeth themselves, but the gums on every side of the tooth. To clean your fixed appliances, we need you to really focus on brushing each individual tooth, and not just the tooth, but the gum as well around the tooth. So I'm going to show you now, you need to get your bristles above the wires onto that gum area, and then you need to brush the teeth, and then you need to brush the inside of your mouth as well. So I'm going to show you now on a very large model. So you open your mouth and go tooth to tooth, using the bristles of the toothbrush into that area, the gum, where the tooth meets the gum. And you go tooth to tooth, all the way around, little circular motions. Try and avoid a yard brush type of action. Just go tooth to tooth, all the way around till you've done it. That should take 30 seconds. Then you brush the teeth themselves in every angle for another 30 seconds, and then you go onto the inside and brush the gums on the inside like that for another 30 seconds. That's 1.5 minutes for the upper set of teeth. Then you go onto the lower teeth in exactly the same way. First of all on the outside, all the way around, then the teeth themselves, and then more importantly, get onto the gums on the inside, tooth to tooth, going all the way around until you've covered every part of every tooth and you've got underneath the brace, underneath the wire at the bottom. That will get every single tooth clean as possible, and the braces themselves and the gums. If you see signs of redness or bleeding, it's a sign that you need to brush more, not less. In addition to cleaning your teeth and avoiding the wrong foods, we're going to give you a cleaning pack. In here we have some Superfloss, which we suggest you use 2 or 3 times a week, in addition to the brushing that you're doing probably 3 times a day. In here you've also got some wax. And this wax will help you if you get little sore patches in the first week of treatment, where you get a little ulcer in your cheek because of the rubbing on the brace. It's only a temporary thing, but the wax will help you to make that less painful until it just goes away naturally. There's also fluoride mouthwash in here and some toothpaste and a little mirror so that if you are out brushing your teeth and there's no bathroom, you can brush your teeth and still check that you've got everything clean. There are also disclosing tablets in here so that you can check your brushing and make sure that you've removed all of the plaque. During the treatment, we may need to get you to wear some elastics to move the teeth into the best possible bite. The elastics may be worn something like this, from one part of the brace to the other part of the brace, so that you can see that the elastic has the effect of moving the upper teeth back, the lower teeth forwards, until we get the correct bite. Please wear your elastics if asked to, as well as you possibly can. And if you lose your elastics, please ring up and we'll send some more to you in the post. So there, you have all the instructions that you need, but don't forget that we're here to help you. If you have anything that you don't understand, or you think there are problems developing, please give us a ring, come and see us, mention it at your next visit. We really want to make sure that we help you get the absolute best result out of this whole process. It should be a very positive thing, and the benefits that you get from this treatment, you should take through the whole of the rest of your life. Thank you.